I want to dive into the anatomy of forward folds today and really why the same fold can land so differently from one body to the next. And I think it really comes from this question of what actually stops us in a forward fold. Most of us were probably taught to look at the hamstrings and maybe the low back, and they're definitely a part of it. But there's another big piece of the picture, and it's the structure of the hip joint itself, the shape of the bones, how the femur meets the pelvis, and how much flexion is available at that particular joint and in that particular body, because it varies so much in each individual body. So we'll look at a few things. We'll look at how the hip joint is built and where that variation lives in each of our bodies. Look at what it can feel like when bone meets bone and how that is different from the quality of the muscle tissue lengthening. And what this might change about how we teach and cue forward folds, because I think that has a really big impact for our students. Okay, let's talk a little bit about the anatomy of the hip joint. The hip is really built for stability. So first, it's a ball and socket joint. Right? The head of the femur is the ball, and the acetabulum, right, which you can think of as the bowl of the pelvis, it's the socket. And I think it's just worth noting this comparison to the shoulder because they're sometimes described in the same way, but they aren't really doing the same job. The shoulder socket is much more shallow, like it's more like a dish. And that shallowness of the joint is what gives us that range of motion we have to lift the arms up overhead. The hip socket is deep. It wraps around the head of the femur, so it creates more stability. There's also this rim of cartilage that deepens that, and a network of ligaments that holds it into place. And so all of those are what give the hips more stability, particularly more stability than the shoulder. It's its job. This joint carries us, it holds our weight when we stand, when we walk, when we balance. And that stability also builds in a natural endpoint for the range of motion here. And this is where it becomes really unique to each individual body. So stay with me. So let's look at the first variation of the joint. The femur is not just a simple straight bone with a ball on top. It has three parts. The shaft of the bone, right? The neck that angles off the bone, and then the round head of the bone that sits on top of that. So three pieces that can vary a lot there, and they do vary a lot between individual bodies. So first, the angle of the neck. So how steeply it comes off of the shaft of the bone. Some are more vertical, some necks are more horizontal, right? So there's a lot of variety in how that comes off. I think of the arm as the shaft of the bone. Where does the neck sit? Then what's called torsion. The neck can be rotated forward or backward relative to that shaft of the bone. It's called anteversion and retroversion, but the names matter less than knowing why it matters and what it does. And then last, the length of the neck. Right? A longer neck can travel further before it runs into anything. So here's why it all matters. When you flex your hip, when you fold, the neck travels towards the rim of the socket. At some point, the neck meets the bony rim of the socket and you stop, bone on bone. When you hit that endpoint can depend entirely on the angle the neck started, the direction it's rotated, and how long it is, none of which we can see from the outside. Okay, so the socket also varies, right? It varies in depth. basically how deep the bowl is. You might even picture this as like different styles of your kitchen bowls. Some are really shallow and wide, and some are really narrow and deep. Right? So if it's narrow and deep, it wraps more around the head of the femur, which can mean more stability, but less range of motion. These people might feel less flexible. But a shallower bowl can often allow for more movement at the joint. Okay, the socket also differs in orientation, right? Meaning the socket doesn't necessarily face straight out to the side, it's angled. That angle can vary. Some face more forward, some more to the side, some more down. So think about what that means for a forward fold. If your socket's oriented more forward, the femur has more room to travel in that direction. Flexion has somewhere to go. If it's oriented differently, the femur can meet that rim of the socket earlier in the forward fold. So what happens at that end, right? The femoral neck travels towards the rim and eventually it arrives. Bone meets bone. No amount of warmth of the muscle tissue can change that. It's bony end range of motion. And I think that's really empowering thing for your students to know. It's structural information. It's telling them why their body moves or doesn't move in a certain way. The joint is doing what it's built to do. And this is that same principle we looked at in the back bends video, just a different area of the body. The spinous processes stack and the spine stops. Here, the femoral neck meets the rim of the hip and it stops. But here's the part that can be useful to you as a teacher. We can't see those internal variations on the socket, the angles of the femoral neck, or the angle, like the rotation of it. But there are some things that we can watch for, and it gives you and your students a little bit more information. One, where does the sensation live? Sensation along the back of the leg, moving through that length of the hamstrings, that tends to point more towards a stopping point in the soft tissue. A pinch, a block, like a stop at the front crease of the hip, that tends to point more towards bony end range of motion. That front of the hip sensation is what we listen for, right? That pinching. Sometimes it feels like something's getting in the way because something might be. Two, how does the body respond over time? Soft tissue can give, not always, but hamstrings, glutes might settle a little bit over a few breaths, over a longer warm-up, and just over the lifetime of our practice. Bony end range of motion doesn't change. And we want to honor where that stopping point is. And then three, how does it respond or change, right? Change with like shape or props. If we widen the legs or change the rotation of the femur, more internal or external rotation, lift the hips on a blanket. If we do any of these things and the fold opens up, we've changed that relationship between the neck and the rim. We gave the bone a different pathway, and sometimes that gives it more space. And if nothing changes, that's information too. We're just seeing where that stopping point is. And then just a quick note on why different forward folds might have different ranges of motion. Right? Sometimes we just see a different outcome. Standing forward folds, it lets the pelvis move more freely over the femurs. Gravity helps there too, and the load is different. As opposed to seated forward folds that anchor the sitting bones and ask the pelvis to tilt forward over a fixed base. This is why a blanket under the hips can change a forward fold so completely for some students. It just gives the pelvis a head start in that forward rotation. So when a student meets that end range, I think what can tend to happen next is interesting. Often the fold keeps going, not always. Some students hit that end point and they stay. I think that's a really good awareness of what they're feeling and responding to in their bodies also. But the movement can continue. It just starts coming from somewhere else. The pelvis stops rotating over the femurs and something else picks up that thread. Usually it's the low back, the lumbar spine. The low back will round, the chest moves towards the legs, and it looks and feels like more range of motion. It's just coming from somewhere else. Because I think our bodies are really resourceful in that way. When we ask for more range and the joint has none left to give, it'll find some. It's not necessarily a problem. It's just showing how our bodies compensate in certain poses. So here's hopefully what's useful to you as a teacher. Right? We can't see what's happening at the joint. What we can see is where the movement's coming from. Is the pelvis still tipping or has it stopped? And is the motion coming from somewhere else? And it's what we can train our eyes to start to look forward in forward folds and just gather that information about where the stopping point is. And that's where the cueing can get interesting. I want to spend a minute here because I think a lot of us were trained in this mindset, both as students and teachers, that treats more range of motion as better. Go deeper, fold further. And when we understand that what's stopping a student is bone on bone, that language can start to sound different. If they've met their bony end range of motion, go deeper isn't an invitation. It's something they can't follow unless they're compensating somewhere else in the body. And they'll follow it, right? Our students are generous in that way. They want to find that range somewhere. And again, it's not that it's bad, it's just where it's landing in the forward fold. So a couple things worth considering. Cue towards sensation, not towards depth of the fold, right? Where do you feel this rather than how far did it get? Offer shape changes as options, not corrections. Widen the legs, bend the knees, sit up on a blanket, and tell students why it helps. A simple, the bony structure of our hips can really vary in each person. It gives them the why. And then vary how you enter the pose. Coming in with a long spine and a neutral low back can give a little bit more information about where the stopping point is, right? Think halfway lift in the spine as you fold forward. And then encourage them to honor that natural stopping point of the pose. Meeting that end range of motion where it's at, that is truly ahimsa in action. Okay. As always, these are just ways to explore the anatomy, the cueing. There's no one right way to teach, to cue, to practice. I hope this just gives you some information about our bodies, how you can support your own body, your students, and how they approach forward folds in their practice. If this was useful, this whole series about going deeper is about this. Right? The back bends video to this companion, this is linked here below. It'll give you a little bit of information, same thread along the spine.